You know, among patients who have AF, but they're at pretty low thromboembolic risk, we know that anticoagulation can actually be problematic, and the guidelines suggest that these low-risk patients actually do not get treated. Well, what's actually happening? That's the subject of an interesting paper that we're talking about, inappropriate oral anticoagulant use in AF patients with low risk of thromboembolism, and this is insights from the NCDR PINNACLE program, one of our favorites here at ACC. I'm with Dr. Johnathan Hsu, MD, University of California, San Francisco, a cardiac electrophysiology fellow. Why did you do this paper, first off?
That's a great question. As you stated, we know that anticoagulation is beneficial in atrial fibrillation patients with thromboembolic risk factors. However, we also know that there are certainly atrial fibrillation patients that don't have any thromboembolic risk factors, and in those individuals, if you anticoagulate them, they may carry the bleeding risks without any of the potential antithrombotic benefits, and therefore you're subjecting somebody at low risk for stroke to bleeding risks of a medication. And we know that there's not much data out there to address this question of how often is this happening and who are those individuals that are being anticoagulated against the guidelines, if you will. And that's why we did this study, is to really elucidate that number.
One would hope it's a very small number. What was it?
We did hope it was a small number, and we were surprised by our findings. We had greater than 7,500 patients from PINNACLE, which is a large number on the, of basically lone AFib patients with age less than 60 and no CHADS-2 score of 0 by definition and no other structural heart disease. And of those approximately 7,500 patients, 1 in 5, or greater than 20%, 22.1% exactly, were actually being treated with oral anticoagulation. So a much higher number than we expected.
Why?
That's the next question, and I would have loved to answer that question. Unfortunately, I'm not sure that the PINNACLE registry gives us that information. We do know the number, and the PINNACLE registry has been great to elucidate that. And I think it's an area for future research, of course, is figuring out who's doing the anticoagulating and why that's being performed, and that's what this study raises, I think, a lot of interesting future studies.
I mean, it's frustrating because we know that a lot of patients who are at high risk simply are not being anticoagulated to the guidelines. And now to find out that we have some low-risk patients who are being anticoagulated, if we could just move these numbers around a little bit and get us a lot happier and closer to the guidelines. So is your bottom line, follow the guidelines?
I think so. And I think you're absolutely right. We have been focusing on those individuals with thromboembolic risk factors that should be anticoagulated, and I think that we need to focus on those individuals from a research perspective and a clinical perspective. But our hope is to show something that's never been shown before, that there are these individuals that likely shouldn't be anticoagulated according to the guidelines, and they are getting anticoagulation. So this needs to be paid attention to. We need to address this clinically. We need to study it further and figure out how to prevent this from happening, and the bleeding complications hopefully from happening to patients unnecessarily.
And of course, PINNACLE is just one of the registries that we have at the NCDR, and there are a variety of papers being presented here at ACC 2013 from the NCDR, so please go to CardioSource World News. We're summarizing a lot of them there. Also CardioSource Interventional News, and for CSWN and CSIN, I'm Executive Editor Rick McGuire.